Sleep your way to better heart health. Hi there, I'm Dr. Michael Kaye. I'm the founder of the Center for Functional Health, and today I want to talk about one of the ways that you can protect your heart health every night. Listen, it's no surprise that maintaining your heart health is vital for overall well being and longevity. When your heart is working well, you have a significantly lower risk of cardiovascular events like heart attacks and strokes, the two leading causes of death worldwide. Making simple lifestyle changes can dramatically slash the risk of premature cardiovascular disease and stroke by a whopping 80%. Research shows that sleep plays an even more important role in cardiovascular health than we once thought. People who routinely get fewer than 5 hours of sleep a night have a much higher risk of heart attacks. The impact seems to be more significant in women and people who have existing health conditions like diabetes. To protect your heart health, aim for at least 7 to 9 hours of restful sleep per night. The quality of your sleep is also important since REM sleep appears to be the most protective. To ensure a well-rounded night of sleep, try to establish a regular sleep routine with consistent bedtimes and keep your room dark and cool. Now let me ask you this. Are you scrolling on social media? Are you doing that in bed? Or are you falling asleep to watching TV? Because you don't want to do that. The blue light of the electronic devices affect melatonin production, and you want to give yourself a break from these phones and computers and TVs at least an hour before you go to bed. It's also important what you consume. Because listen, you don't want to watch a horror show or politics or the news, kind of like the same thing, before you go to sleep. It's not good for the brain. You also want to avoid alcohol and late night eating because that can contribute to restless nights of sleep, especially if you do this close to bedtime. All right, so now let's talk about heart healthy foods. There's actually a lot when it comes to nutrition and heart health. You stick 10 docs in a room, 10 nutritionists and dietitians, and what you get is a lot of bickering and posturing. Who's right, who's wrong. So what nutrition is right for you? Well, that depends on your current health status, goals, and your blood work. So today, I'm going to talk in general terms with respect to nutrition and heart health. A heart-healthy diet is one of the most effective ways to improve heart health. It's more important than ever as the standard Western diet of highly processed foods ultimately harms our health. So we have to talk about obesity. Obesity increases your risk of poor cardiovascular health, but even if you are within a normal rate range as well, too much salt or too much sugar or too much saturated fat can harm you. Often people don't realize that their blood pressure or their cholesterol levels are too high. Personally, I check mine every 3 months. So it's important to work with your healthcare practitioner on a regular basis. One of the most studied diets for heart health is the Mediterranean diet. It centers around fresh produce, seafood, healthy fats, and olive oil, and plenty of fiber. Even if you don't follow it 100%, choosing these food groups will help support your heart health. Some studies show that this diet, the Mediterranean diet, can reduce your risk of cardiac events by at least 40%. Now, vegetables are the heart superheroes packed with antioxidants like vitamins A, C, K, minerals like potassium, magnesium, and fiber, all vital for heart health. Their antioxidants combat inflammation and oxidative stress, shielding blood vessels from damage and lowering heart disease risk. Fat. Fat is your friend. Fat doesn't have to be the enemy. Monounsaturated fat and polyunsaturated fats help lower the alleged bad cholesterol, LDLs, that's your low-density lipoprotein, and raise your good cholesterol, that's your HDLs. Good sources include olive oil, nuts, avocados, salmon, and olives. Now let's talk fiber. A high fiber diet lowers cholesterol and blood pressure. Soluble fiber, found in many whole grains like oats, beans, psyllium, and some fruits and vegetables, helps remove excess cholesterol from your blood. A fiber-rich diet also protects your heart by reducing the risk of diabetes. And then there's spices. Many spices also have strong anti-inflammatory properties like turmeric, garlic, saffron, and ginger. Not only delicious, but they can also lower your risk factors associated with heart disease. And then there's supplements. Not all supplements are created equal. Not everybody needs the same supplement. Helpful heart supportive supplements, though, are omega-3. They can lower triglycerides and reduce inflammation. They may do those. CoQ10, coenzyme Q10. It supports cellular energy, has antioxidant qualities. Then there's magnesium. Magnesium regulates blood pressure, helps with heart rhythm. And then there's garlic. Garlic lowers cholesterol and blood pressure. And of course, psyllium. Psyllium husk, which is fiber, helps to lower cholesterol. Now, keep in mind, the Mediterranean diet is not for everyone. However, it is a good start. It's a good start towards a heart that you want to be healthy. And last topic, maybe one of the most important topics related to heart health, is stress. A healthy heart contributes to longevity and quality of life and plays an important role in how well you age, your overall energy levels, and disease prevention. One recent study found that the overall physiological age of adults with good cardiovascular health is much younger than that of people with cardiovascular disease. Gotta watch out for the stress. Stress hormones like cortisol can help you respond to crisis, but they also have the detrimental effects on your health over time. Research shows that stress raises the risk of cardiovascular disease, coronary artery disease, stroke, and myopathy. Myopathy is a condition that means your heart isn't strong enough to pump blood effectively. It's important to note that this dynamic just doesn't apply to extreme stress events. Chronic stress. Chronic stress also has a negative impact, as does the stress of loneliness. Of course, it's often hard to avoid stress, so it's important to develop healthy ways to deal with it. When times are tough, remember to practice self care. That could mean taking a break from work, reading a book for leisure, using a sauna, taking a bath, taking a walk outside, or reaching out for support. It's good, it's healthy to reach out for support. Stress reduction techniques include meditation and deep breathing. They can also lower your blood pressure and reduce the strain on your cardiovascular system. Well, that's it for now. I wish you a wonderful, happy heart day. Stay healthy, stay strong. I'll see you soon.